Does it seem we live in a day and age where people want to diagnose ourselves in order to understand ourselves? Honestly, Chico, I go back and forth on that. I hate casting blanket statements on stuff, so I'm going to refrain from saying that that's like a universal thing. I will say that anecdotally, it's a mixed bag. Like, there are some people who would say that it's really helpful to have a diagnosis and that they are really glad that they have one, because then they can understand the criteria for it and they can have a treatment plan designed and they can have some understanding of what it is and it's represented in some way. There are other people that would say, you know what, I don't really give a shit what the diagnosis is. I know what kind of change I want and I'm going to try to get it. It just depends on the person. But I don't know that people are like actively trying to necessarily get a diagnosis. I do think in some ways that people who do want a diagnosis would like it as a way to be able to explain what's going on to other people in a way that people will take seriously. Because one of the problems with mental health right now, because of the stigmatization of it, is people don't take mental disorders as seriously as they should. So sometimes people need a diagnosis in order to legitimize their experience in the eyes of others. Certainly in the eyes of insurance companies. Insurance won't reimburse me if I don't put a diagnosis down for a person that I'm seeing who's submitting to insurance. It's pretty shitty.